Hi everyone, this is Mr. Neil Writer, consultant audiologist and also director of earwax. Welcome to another demonstration video of our recently developed wax scope, which will be available to purchase from early autumn 2022. If you are interested in learning more about the wax scope and purchasing it once it's available, please feel free to email us at info@clearwax.co.uk and we shall add you onto our mailing list so we can keep you updated. Now, I feel this video, for me, is a perfect demonstration and illustration of why I developed the wax scope in the first instance. Now, as you may already be aware, Clearwax developed the iClearScope endoscope back in 2015 or 16, I can't remember now, so it's been a few years. And if truth be told, nothing can compete with an endoscope, and I've got to be frank about that. And I think, and the main reason for that is the field of view. It's just uncomparable, it's unparalleled in terms of the visual, the optics. However, I must also be frank in that not everyone can use an endoscope. It is a tricky skill to develop, and it's through no fault of anyone who picks up an endoscope, but it does require a high level of what we call bilateral integration, so coordination between both hands, because you're having to use the endoscope to stretch open the ear and also visualise the earwax, whilst also then using the other hand to insert the instrument and manipulate the earwax out of the ear, and some people just find that difficult to do. For myself, it's just become so natural now, and there was a bit of a learning curve like with anything, but so if you are able to use the iClearScope endoscope, that would be, for me, there's nothing else that can compete against the iClearScope in terms of full wax removal. But before, what inspired me to develop the iClearScope was I was originally trained in removing earwax using loops. And this procedure is a very good procedure in terms of demonstrating and highlighting why I decided to develop the iClearScope after using the loops, because with loops, there's no way I'd be able to complete this procedure. Now, this patient has got a very narrow ear canal, so that's one of the first difficulties. Also, the wax is very deep in the ear. Now, I'm using the smallest specular. We've got different specular. This is the 3.5mm. Now, I would never be able to remove anything like this using head loops. This is on the eardrum, and you'll see in a moment when I remove this crusted dead skin off the eardrum, it's going to reveal the handle of malleus, which is directly behind the skin here. There we are. And now you can see the handle of malleus. So that piece of keratin was on the eardrum itself, and now it's in full visual. There's also some wax there, you can see in the anterior superior quadrant, so almost in the anterior recess, and again, using a fine end and using the wax scope, I'm safely, without any cause of concern, able to insert the fine end into the ear and remove that from the anterior recess. There's not a chance that we'll be able to possibly even visualise the eardrum with using loops, never mind removing wax off directly of the eardrum. And it was interesting, the other day at the clinic, we had almost like a technology day. We were comparing all the technology available in the market for earwax removal, so the iClearScope, an operating ENT microscope, a very good pair of loops, and some other technologies as well that's on the market at the moment. And so people that had some of these, I mean, I've got loops and I've got a microscope, and some people that I know have got some other device and they brought that in, and I just gave them a demonstration of the iClearScope and the wax scope. And of course, the endoscope, was, in terms of optics, it was unbelievable, but by far, everyone else felt the wax scope was head and shoulders above everything else in terms of wax removal, because it's portable, it's lightweight, the view is stunning. In terms of the magnification and clarity, the focus is unbelievable. The only thing that is different between the wax scope and the endoscope is the field of view, and I mean, that's something that's unavoidable, because the purpose of using the wax scope is the reason for developing it to make it more user-friendly, so it incorporates a speculum. So you're no longer having to use the endoscope to stretch the ear open, which some people can find difficult. Instead, you're using a speculum, and as an audiologist and any healthcare professional that is trained to look inside the ear, we all should know how to use a speculum. Now, having said that, it's still, you're learning to use the speculum to straighten the ear canal past the second bend, because that's the crucial bit, because you get some patients with very, very bendy ear canal, so there is a bit of a learning curve there still, but far less than an endoscope. Now, I've got an ENT microscope, and yeah, the magnification's fantastic. And I was speaking to a prominent ENT consultant the other day, Chris Colson, and I've got another ENT colleague, very good friend of mine as well, Darius Rajali, and they all agree that training people on a microscope with binocular vision is a difficult thing, and they've noticed that themselves during their careers when they're training their registrars and ENT nurses, that some just really, really struggle. And that's because you're having to incorporate binocular vision. You're looking through two eyepieces, and what the ENT microscope does, and some certain head loops, they artificially converge your interpupillary distance. So in order to have depth perception with binocular vision, you must be able to see an object with both eyes. In the case of the ear is very narrow. The ear canal diameter is less than our interpupillary distance, so the distance between our pupils. So obviously the microscope and some head loops artificially converge your interpupillary distance, so you're able to see wax with both eyes. Now, they both agree that when you're working really deep in the ear, and especially in this kind of case when it's a narrow ear canal and you're removing wax of the eardrum, that binocular vision kind of goes out the window, because no matter how advanced the microscope is or some certain loops, you just simply cannot converge the eye artificially close enough to be able to visualize the wax or dead skin off the eardrum. You can just see the clarity we've got here, the magnification's great. We're working on some enhancements of the app as well. We're going to have a zoom function. Not that I think you need it, but it'll just be a good additional feature. Now, the speculum we were using, these are not our finished, these are just our prototypes. So they are getting injection molded, so they're going to be high, obviously they're good already, but they're even going to be better. And the prototypes, the thickness of the speculum is a bit thicker than it will be with the final product. So even with this smaller speculum, which is the smallest one, 3.5, we're hoping that once we've got the final product, that you're going to actually see less of the speculum. Now, with the 5mm speculum, I did a procedure yesterday that I uploaded onto LinkedIn and my ClearWax YouTube channel, and also Facebook and Instagram. We used the 5mm speculum because the patient had a slightly larger ear canal, and you just weren't able to see the speculum at all. It was completely out of view, which is great. Now, well, did you see the slight rim? Now, I like the idea of seeing some of the speculum because it just helps guide you in the ear. You kind of know where you are, and you can almost use it as a guide to help focus the wax scope. So this is, so we've cleared the outer part of the patient's ear canal. They had really thick crusted dead skin. Now, we're working medially, and again, patient's got a really, really narrow ear, hence why we're using this 3.5mm speculum, the smallest one. But I would not be able to remove this when I first got trained with head loops. It was just not possible. It's too deep. It would have been all blurry. I wouldn't have got the view. I wouldn't have felt safe. But here, I've got complete control. I feel completely at ease removing this. And you'll see again, similar to the left ear, the first ear, we're removing some dead crusted skin directly off the eardrum. So again, just going to stretch the ear open. With the specular, we're now going to get this crusted skin, which is on the eardrum, in focus. I think I'm using a standard Zollner at the moment. And we're just slowly removing that away. And you can see some of the posterior aspect of the tympanic membrane that's now visible. Now, no doubt the patient's hearing would be significantly improved already because the main bulk of the occlusion's gone. But I'm just going to try and remove a bit more now. Just to help with the visuals, I'm just removing some dead skin. More laterally, this is more near the cartilaginous portion. But I just wanted to remove that just to improve a bit of the view deeper in the ear. And adjusting the focus is so easy. It's just literally, as you're in the ear, on the app, it's a slider that we're going to have, and you just go up and down, and it takes moments. Now, that's one of the other things I found really difficult with head loops, and even a microscope, because, I mean, for me, it took a while to develop the skills with a microscope as well, because that binocular vision. But the thing that I really struggled was the focus. I would lose the focus so easily with both if the patient moved, or with a microscope, it's more so if the patient moved, or if you're having to manipulate the microscope to visualize a different part of the ear. It's very hard you have to keep getting it in focus. Now, the wax scope is so much easier. You just put the speculum in, and then you just adjust the focus with your finger. With the loops, it was a double whammy, because not only the patient moves, or you're having to move if you're removing wax from a different part of the ear, but when you're coming out of the ear to remove wax of the sucker, like I was there, you're then having to readjust your head position again. So it took a lot longer. So again, you can see we've removed some dead keratin. Now, we're using the fine end there. You can see it's a lot thinner, and it's all in focus as well. I noticed with some other technologies that I was trialing the other week, is that when the suction probe goes in, and I'll come back to that, because this is, again, right on the eardrum. So we've got a good line of view, got it in focus. Just going in with the fine end, we just took that directly off the eardrum. Yeah, what I noticed with some of the technologies is like when the instrument's in the ear, it no longer looked, it was all dark and it was all black in appearance, it was covering half the screen, it looked distorted, the suction, it did not look like a suction probe, it was like a zigzag. Yeah, it was just a bit, and that again was one of the reasons why I really pushed the development of the waxscape in the last year or so. So I definitely feel there needs to be a really good alternative to the endoscope, and I think here we are. I'm really, really confident in this technology and in what we've managed to develop here. And it has taken a long time. There was many obstacles that we had to overcome. In terms of weight, this is extremely lightweight. It can be compared to other technologies out there. The way it's being held as well helps, because you're resting some of the weight on your hand. It's going to be held horizontal. Although you can hold it in whichever way you want, you're not limited, but through practice I felt using it horizontally, more like a orthoscopic brace, will help. And you can see we've just got this dead keratin. Now we could leave this, but like I said, I felt comfortable removing it. There's no, I didn't feel uneasy at all, and just trying to get as much out as we can there. See some dead skin. I've got a few more videos with the waxscape that I'll upload now. It's been a bit more challenging because a lot of the, if you're a YouTube viewer watching this, I can understand it's not the best viewing pleasure for subscribers because the view's different. But I'm also uploading more videos to my YouTube fans with using the iClearScope, so I'm doing kind of double the work now. So these videos, by all means, if subscribers want to watch, brilliant, and many understand the benefits and they actually enjoy the view because it's so magnified and clear. But I know some prefer the iClearScope, so if you're watching this and you prefer the iClearScope, we've got a whole dedicated YouTube channel, the Wax Whisperer, or type in the Hair Clinic. And on there, I'm trying to upload more exclusively iClearScope videos. Again, right near the eardrum there, it removes some flake of dry skin. We're going to have a view of the eardrum in a moment. It's slightly tympanosclerotic. We're going to get it in focus. There we are. It's slightly opaque. You can see everything around you.